Hello, I'm Mary Burgess and I'm a consultant clinical psychologist working at the Wellington, and I wanted to make this video to talk to you about some of the anxieties you may be having at the moment with your diagnosis of breast cancer, and also to share with you some tips that you might find helpful in managing your worries. The first thing I would like to say is that a diagnosis of breast cancer is always a worrying time. And particularly, whether you're waiting for results or for decisions to be made about your treatment, getting through treatment, or adjusting to post-treatment. And with the arrival of COVID-19 amongst us, there's an additional anxiety and threat. And with this has come a lot of change and loss. And I'm aware that many of you will be seen at different hospitals or centres. And so at a time that is already worrying for you, you've got an additional burden of worry. And whilst that is important to acknowledge, I wanted to share with you some ways that you might begin to feel better, because the impact of cancer and its treatments, as you know, is new, and therefore it will seem frightening and uncertain. However, with time you will become more aware of what is helpful and what you need. And I would encourage you, as a first step, my first tip would be to acknowledge how you're feeling. Feelings are normal and they are there for a reason. So tip number one is to acknowledge your emotions and feelings and to be compassionate and kind to yourself. Number two, it can be helpful to look at how you respond to your various worries, and you will each have different worries depending on what you're facing and of course who you are. We're all individuals. So the second tip I would encourage you to think about is to become aware of what is worrying you and how you respond to it. And writing down your worries, making a time to write down your worries, can be a very helpful first step to unpacking what's going on. And as part of that awareness, becoming aware of how those things make you respond. So what we would call your sort of normal stress response. And we feel stress and anxiety in our heads, so be aware of what are you thinking, what are your worries in your mind. We feel it in our bodies, so become aware of how you feel in your body. Do you feel anxious? Do you feel dizzy? Or do you have pain? And also notice how you respond. Are you sleeping? Is your sleep being affected? Are you more irritable? Are you avoiding certain things? All of which are absolutely understandable, but all that matters is for you to become aware of how you respond. The next aspect of this is to think about how helpful your response is in terms of you managing the worries that you're facing. And what I would encourage, in the handout linked with these videos, there is something that we call a hot cross bun, and you might want to look at that and fill out your own one in terms of what's the particular worry, what's the thoughts that's going through your mind, what do you physically do, and what do you what do you actually end up doing. And I'd like you to look at that, read it and see what you think. And there's also, after that, there is also some helpful strategies. And again, beginning to identify what's helpful. And to this end, be patient and listen to your body. It takes time to find the new normal, but have faith. You know yourself, and you will come to know yourself better than anybody else. And identifying some helpful strategies, whether it be doing some relaxation or speaking to somebody, or noticing when you feel a bit better, all of those things can be very useful strategies for you to have at this time. And starting with yourself, because feeling a bit better in yourself is important, is an important first step to you being able to think straight and to help solve your concerns. What can be helpful, tip number 3, is to notice when you feel better or what you feel grateful for every day. Often when we're really under pressure, the brain, which has a negative bias, so it looks out for threat, not always very helpful. But if you look for times and things that you have felt grateful for or that have been positive, that will help counteract some of those negative thoughts. Notice what you do, whether it's relaxation or whether it's yoga or simple breathing, when you physically feel better. And behaviour-wise, what do you do? Whether it's speaking to somebody on the telephone at the moment, or listening to music, getting out, even though that might be limiting for you at the moment. Just identify your helpful box of strategies, helpful strategies. All of these will help you feel a bit better. And it's when you feel a bit better, then when you feel anchored in yourself, you can begin to start solving some of the issues. During this time and times of change, our brain does respond with what is often called the fight or flight response. And this lies in our autonomic nervous system, and our brains have developed to be on the lookout for danger and threat. And sometimes when they go into overdrive, it can undermine our ability to cope with what we're finding, what we're dealing with. So, it can stop us being able to think clearly, as I'm sure many of you may well have experienced. So, tip number 4, if you're finding yourself feeling really overwhelmed physically, getting maybe even panic attacks, or feeling sick or dizzy or can't think, try one of these 4 TIPP exercises, and they're in the sheet that goes with this video. The first one, T for temperature. We know that reducing our temperature lowers the parasympathetic nervous system, which is the fight or flight, and encourages the sympathetic nervous system, which is often called the rest and digest nervous system. So, a good way, and it sounds slightly strange, is to get a bowl of water, cold water, and submerge your head into it, up to about here. Put your head into the water and obviously hold your breath, and do that for as long as you can, that's comfortable, and then come out. What that does is it very quickly reduces your blood pressure, your heartbeat, and you will have a sense of physical calm. So it's one very good way of managing that high arousal parasympathetic nervous system fight or flight response that we all have at times of stress. The other bit, I, is intense exercise. Now, this may not be possible for you at the moment, but if it is, 3 minutes or up to 3 minutes of either jogging on the spot or star jumps. Again, very effective, quick way of reducing that parasympathetic nervous system fight or flight response. But I acknowledge that this might not be a good exercise for you at present. The third P is paced breathing, which is breathing in for 4 and breathing out for 8. So breathing in for 4, breathing out for 2, 3, 4, 5, 6, 7, 8. And that can, again, really lower your parasympathetic nervous system and get you relaxed. And if you do that for 20 or 30 seconds. And the other one is, the other P is progressive muscular relaxation, which is tensing and relaxing big muscle groups in your body. And there is an illustration of that in the notes associated, at the end of this video. So any one of those tip exercises is a really good SOS emergency help strategy for reducing your anxiety. And the 5th tip is to ask for help. Ask for help and find out what's available. And I realise that this might be changed. You may be with different teams at the moment if you're having your surgery in a different hospital, but find out who you can speak to, whether it's your clinical nurse specialist or one of the many charities, Breast Cancer Care, The Haven, Macmillan. Again, there's a list in the resource pack that comes with these videos. Talking to people is a little bit like writing it down. It can help give you a bit of perspective. When we're in the middle of something, it's often very hard to see what's going on, and that happens to everybody. The 6th tip is to keep in mind that partners, carers, some of who may or may not be with you during this strange time or may not be so accessible to you, they might need support. So encourage them that they too can contact these services, and to encourage them to get some support. And number 7 is children. Some of you may have children, and children are very observant, and as parents or as carers, the last thing we wish to do is to cause any distress. And something I see is from people not wanting to upset people, and that's why they keep it to themselves. However, children are very smart from all ages, and they pick up what's going on. So speak to them or just check out whether they're all right. Again, there's a very good link in our resource pack associated at the bottom of this video for fruit fly, which can help you think about how you may have those conversations. And finally, as part of your self-care, try and notice when things go well, and tell somebody. Schedule in something enjoyable for yourself, however small, really important. And take some time just to calm yourself. So they are my top tips, and I'm sure you have many more of your own, and but please do read through these notes, and I hope that by just seeing somebody speaking may have been helpful. And I wish you well, and you will get through this, and by thinking about how best you can get through this and look after yourself is really key. And so being kind. So I wish you well, and I'm signing off now. Bye-bye.